And now we're going to bring up our first company, which is Simplee from Palo Alto. Simplee connects directly with insurers to categorize and explain medical, dental, and HSA expenses in plain language. And presenting today is Shoval, who is the former managing director of Shopping.com, and he is the founder and CEO of the company. So you will have 5 minutes to present.
Thank you so much. Hi everyone, I'm Shoval, and I'm excited to present Simplee to you. So I'm sure many of you have a pile of medical bills you're trying to avoid. What is it about? Did I pay it already? How much my insurance cover? I mean, let's face it, healthcare sucks. And some of you may think, well, my insurance pays most of it, so it's not a big deal. It's actually not true. We pay every year over $3,600 on top of paying for insurance. So is it really something you want to forget about, especially when 8 out of 10 bills contain errors? That is exactly what Simplee solves. We make it easy and simple to see where your money goes and why, and we help you get more for less. Just link your health insurance account and provide your credentials. Our technology does the rest, very similar to Mint.com. You will instantly see how much money you spend, what your deductible status is, how many doctor's visits you've had in the last year, and even your health saving balance and transactions. I would assume those are numbers that most of you don't have access to today. And this is our version of a medical bill. Again, not something you would expect. We simplify the bills, explain them in an easy-to-read view, cross-reference your deductible bar inside the bill, and even help you detect potential errors. And if and when you feel comfortable, we allow you to pay all your doctors with just 2 clicks. Leveraging our technology, we replace your 60-page benefit booklet, that I'm guessing most of you have it stored in your garage, with a friendly UI, so you'll be able to understand your plan and benefits. And we also use this information to remind you about preventive care, free preventive care, that will keep you healthy, and also cross-reference the plan rules with the actual bills to detect potential problems. And the great thing about Simplee is we call you when it matters, like when a new bill is ready for your review or when you have a payment due. We also send you a monthly update and relevant insight, like free preventive services that you haven't utilized yet, or how much money to allocate to your FSA or HSA for next year. Our vision is around managing healthcare financials. Our initial focus, as you could see, is around managing bills, but our potential is much, much greater. As we have your historical consumption, we can help you find the right plan for you and stop guessing. And we can also help you shop around for the right doctor, product, or service. Our go-to-market and initial monetization is providing our platform in a software as a service to employers, third-party administrators, and HSA banks, so we can help them better serve their user base. We've already signed 5 partnerships that have access to over 4 million lives. In addition, as we grow our user base, we will become a key player in consumer out-of-pocket payments and can monetize those transactions. The rise of consumer out-of-pocket costs that you saw before is not only a problem for you and me, it's a huge collection issue for the medical providers, and we can help them increase their collection and reduce their administrative costs, and basically become their patient payment portal. And by the way, the consumer out-of-pocket market is over $300 billion a year, and it keeps growing. With Simplee, we provide a trusted platform that allows consumers to easily understand and pay their bills, and we're already seeing great traction on our platform, as over 10% of our users are already paying over $1,000 a year using our payment feature. How many businesses do you know that can convince consumers to pay over $1,000 a year? The reason why we've been successful is because we remove the stress and the complexity, and we only suggest consumers to pay when it's error-free. So you tell me, what do you prefer? Your current frustration or the Simplee way? Everything digital, easy to understand, error-free, and you can track and pay automatically. Ladies and gentlemen, this is the future of healthcare financials. My partners and I have proven track record in building consumer web applications and analyzing mass scales of data. Our service is free since last summer, and we're getting great traction and feedback. Thank you.
Thank you very much. Good job. Bill, you look like you're leaning forward. You look like you're ready to talk.
Do you have do you envision that the platform will be in providers' offices so I can pay my copay at the time of payment or at the time I'm seeing somebody in a private practitioner's office or a provider's office?
I think that once we integrate with your medical provider, you will be able to pay your copay even on your cell phone. But what we start with is the problem that on the one hand your doctor treats you and decides what the total amount is, but your insurance company needs to tell you how much you need to pay out of that. And it takes a month or 3 months for that to happen, and you need to deal with all that mess. So that's kind of the starting point that will allow us to get consumers comfortable and able to make their payments. And when we integrate with the medical provider, we'll get to the copay as well.
So is that secondary? I missed it, or that's not something you're doing quite yet?
Yes. Most co-pays are being paid at the doctor's office anyway. So we're going after the deductibles and the co-insurance payments. And again, they're over $3,600 for the average family. So there's a lot of money that involves there.
Right. Steve.
Tomer, I love this. As a consumer, I'm all over this. You can totally see the value. Can you spend a little more time talking us through the pitch to the employers? So in other words, what are you selling to the employers? What are they buying when they sign an agreement with you on this? What's their incentive? What's the value proposition to them?
So employers have, I would say, one responsibility and one problem. Their responsibility is to provide benefits for their employees. And when they provide benefits, they provide resources and tools to be able to use that. And when we talk to employers, they mention that people don't want to talk to someone over the phone. They're used to using tools on the web. In addition, the employers have a huge problem with the rise of healthcare costs. You know, Starbucks spends more money on healthcare than they do on coffee beans. It's a huge challenge for them. And we can help them reduce that cost. Because one very important initiative that they have is to shift their employees to a consumer-driven health plans. And basically get their employees to be more incentivized to become smart consumers of healthcare. But they have very hard time to get those employees engaged with them and go to those plans and show them that it makes sense. And in addition, people who shifted, there are a lot of great feedback about those plans. The problem is that you don't have the management tool. And again, I'm going back to that disconnect. It's all of a sudden a higher deductible, but you don't really know how to manage that. So for us, with the shopping engine, with the friendly UI and engagement, we can help them start going towards that management of cost.
Right. So you're lowering the barrier for employees to shift to a higher deductible by giving them the tools to manage the higher deductible.
Yes. Yes.
Isaac.
So first of all, really cool idea. I just don't know what I'm going to do when I don't get 4 copies of the same bill.
Thank you.
Can you just talk to me about, first of all, 2 quick questions. The first is about the data. Are you storing any patient data, or are you just scraping off of different systems like the insurers? And the second is, talk to me about the selling cycle, because employers use this system when you have onboarding or during the benefits season. It's not a year-long process. Yeah,
so first regarding the data, we have a proprietary technology that scrapes the information. And there are a few key advantages with that. A, it allowed us to scale very quickly. The problem is, if you try to connect with the insurance company and get the data, it's going to take you forever. And we were able, right now, to serve 8 out of 10 people who are coming to Simplee and already support their insurance companies and their HSA accounts. So the technology really gives us scale. And in addition, it also gives us freedom, because we get the data because of your permission as a consumer. And it's your data, and if I would ask the insurance company to give me that, there's going to be a lot of potential constraints. So we definitely see that as our secret sauce and one of our differentiators. In terms of the sales cycle, definitely an issue, I would say. When we started, I think we made a very smart decision that said we're going to open it for everyone immediately, because otherwise I would be selling it to employers the first version that we didn't know if it makes sense or it doesn't make sense. And we've learned so much, and we iterated a lot to really show very promising results. We're showing them that over 60% come back every month, that the open rate for our emails is over 60%, and the click-through rate is 15%, 20%, numbers that the HR managers look at, or the HSA banks, and their eyes open, because it gives them additional opportunities. An employer, we talked about employers, they bring companies that are doing a wellness program, but they can't get the employees to use them. With Simplee, now you have a bill, it's $100 next to it, it's going to be, well, if you want the employer to pay for that, go and take this training.
I'm still stuck on your first slide that says 8 out of 10 bills have errors in them. It's hard for me to believe, but what is it that's happening that's wrong that makes it so that 8 out of 10 bills have errors in them? And is that really true?
Well, I would say maybe it's not 8 out of 10, but it's definitely significant. And we're already seeing on our platform users who were able to save money just by having a clear understanding of the different views. We have a consumer that his son has ongoing treatments, and he was able to see that the co-insurance, the percentage, was usually 30%, and it was 10% all of a sudden. So it was clear to him that there's a problem, and they refunded him over $1,000. How many opportunities like that are for consumers? In terms of why it happens, I think there are a lot of inefficiencies in the healthcare system. A lot of inefficiencies. These are giant companies, again, talking about the process that one company tells you how much you need to pay, the other needs to tell you how much you need to pay. Errors happen in those intersections, and I think that's what we bring to the table. We want to make sure that consumers know that we advocate for them, and we help them detect those issues.
Now, if you're successful, you get driven out of business, because there will be other competitors doing the same thing, and once the problem is solved, there'd be no reason to use you, or you would marginalize. So 10 years from now, what does this business look like?
Oh, I think it's a gigantic business. It's not only about the error detection. It's about, what gets us excited is the fact that I think healthcare for consumers, it's like travel 15 years ago, that you had to actually go and meet a travel agent to get a flight ticket or a hotel, where today you can do it on the iPhone on your way to Tahoe. I think that it's taken away those piles of papers, that anxiety that you're not sure what's going on, the fact that you pay over check or call someone that answers it, you get 3-4 letters with red fonts in them that scares you, into something that is applicable for today's age.
Let me jump in. We're running out of time. Bill?
Let me just jump in just for fun here. So I was going to make a comment, but let me back up a second. You know, the interesting part in this business is I don't think so much managing the errors, that'll be part of it, but I think where you eventually go will be helping people find their insurance plans, and more you'll be replacing a legacy system, which is a big burden in the whole system, which is the third-party kind of consultants that are out there that help big businesses buy insurance and are largely not value add to the process. One of the things, and then eventually finding the least expensive care in the neighborhood, which is I'm going to come back to, but I was going to make the point that, you know, one of the things that businesses would like to do probably, if you read Clayton Christensen on this topic about disruptive innovation in healthcare, he would say that one of the things that businesses are going to want to do is have give employees who have chronic diseases and things like that incentives. And you may be the point where they can most easily measure someone's behavior, like a copay at a primary care doctor's office, or, you know, someone who has diabetes. Will you go ahead and take this diabetes plan and pay, you know, $25 a month, but your bonus is $500 at the end of the year if you go ahead and consume this. So I could see that choosing plans and incentive payments for corporates might be kind of one of the ways that people are driven to kind of consume some of these resources. Have you guys thought anything about those kinds of ideas?
And do that in about 15 seconds.
15 seconds, sorry.
I agree with everything you said, and I think that's why I think there's a big potential. I would say the reality is people don't want to deal with their healthcare, right? You want to be healthy, you want to forget about it. And I think we found an important gap and pain point, the financial aspect, that will incentivize people to start dealing with their healthcare financials. And that would give us an opportunity to then do other things as we scale, as we bring more people, as we give them different choices. So right now, the focus is all around the financial aspect. That is our starting point. People want to save money. People are afraid that they're being screwed. That's what we start with. Then we can build on top of it.
We're not afraid. We know we are. So Tim, about 30 seconds, wrap this up for us.
Look, I think it's great. I think making complexity simple is great. I think consumers will jump on it. And then you'll have the end user connection. You'll have connection with the corporate and end user. I think that's going to be a big opportunity for big business over the long haul. And I encourage you to go after it because it is sure messed up.
Thank you.
Thank you. And with that, and we're going to start with Steve because he was jumping out of his seat. Get the next presentation up, and then we will bring up our second company.